I'll be back in some minutes. Hi, everybody. It's 8 and 1. Do you want to start now or do you prefer to wait a little bit? Hello. Is anybody in there? Yeah.
Good night, doctor.
Good night, Maria Tatiana. What can we do? Do we start now or do you rather to wait a little bit?
I'll wait a little bit.
Okay. Maybe 3 minutes until 8 and 5?
Yes.
Okay, perfect. So 3 minutes more and then I'm gonna come back, okay?
Okay, doctor.
Okay, time's up. Let's start, okay? It's such a long presentation, I think. So I need to start because we have a schedule to follow on, okay? No. Da-da-da-da. Mhm. Okay, tonight we have our used theoretical class. And this is the summary of today, the content. We are going to talk about the nervous system, mental illness, mental diseases, mental disorders too, general view of blood, and oncology. Of course, a general view of that, considering just important details about expressions and ways of talking about it. My baby is here again with me. She's going to stay together. She's going to take the class with us. Let's go ahead. Let's talk about the nervous system. I think one of the most important and interesting systems. And of course, we consider as the most important point of view, the brain and its functions. And we, of course, have this picture when we check, we show the differences between the left and the right hemisphere, considering the situation, considering the functions that have been in studies for around, well, for more than century, maybe from the beginning of the medicine history. And then we have to take it in count. You see the left and the right. The left, the analytic one, the right, the creative one. That's the common way to talk about it. But when we check about anatomical review, of course, by homework, we must consider these differences, just a general view of this, not in an extremely detailed way. So let's try to organize these ideas, okay? We have to consider, of course, the anatomy of a neuron, the neuron anatomy with all of the anatomical details in English, not in another language. I consider that it's not as important to talk in another language. At this moment, no Latin, no other expressions. Please check all of these anatomical details, okay? Of course, the red guy is telling us that it's for homework. Take it in account in that way. We have this first slide that is talking about the ACE and the SAM neurons, the types of neurons and the neuron functions, just as an information. We consider the afferent neurons, the connecting neurons, and the efferent neurons. That's the ACE. Please give me a minute, please. Okay, I'm sorry, I come back. My baby started crying, I don't know why, but let's work on this. It's the moment to do this class. Well, we have this type of neurons, the ACE and the SAM, just as an information for catching vocabulary. It's for understanding the differences that, well, we must consider on this. Just for reading, take it in account because it's general knowledge, I think. Going ahead, we have another anatomical review, again, a general one. So, check again the principal nerval roots. As you know, the most important, the biggest ones. Again, anatomical review, very important. In the same order, we are going to have homework about it. So let's consider the differences, okay? Now we have a cross-section of the brain showing the meninges and the prospective coverings. Check this again, anatomical review, not such a big and great details. The most general and the biggest information for taking an idea what we are going to talk about. Again, a similar slide, considering the same information, the major parts of the brain, of course. And now we have this. Brain parts and their functions, again, information slide for considering the general information, maybe general part of the anatomical structures, take it in account for being in practice and, well, not missing these details in English and catching vocabulary, how to express about it. Let's go ahead. Now we have this slide, the cranial nerves. Check again, it's homework, anatomical review. Take it in account for practicing, for catching information. And, well, we have to follow its anatomical review for checking and checking again. The dermatome versus the myotome. Dermatome and myotomes, of course, very important structures that we consider all the time. We have the details about the anatomical reference and how it's called in English, of course, and we have the differences in the box to compare. Check this again, information slide for anatomical review and important information about this way of talking, this vocabulary, okay? More anatomical review, more details, taking in account anatomical structures for their limits, take it in account. Again, homework, this is homework. The slides with the red guys are homework. The slides like this without the red guy are for general information, okay? More details, the CNS and the PNS, CNS, central nervous system, and the PNS, peripheral nervous system. Take this information in account. Of course, it's homework. And then we have the overview, structures and combining forms. Of course, functions are for you. Major structures, brain, related combining form, cerebro or encephalo, the spinal cord with myelo or mielo, according to the situation, or nerves, neuri or neuro, and the functions that you're going to check, and the sensory organs and receptors. eyes, ears, nose, skin, and we here need the tongue, but the smell and that's not true. The word parts, we have the word roots, the prefixes, and at this point the suffixes, I'm sorry. The word parts, cause or causal, cerebro or cerebro, concus, concuso, contus or contuso, encephal or encephalo, the suffix estetia, the word estet or esteto, suffix graphy, mening or meningo, miel or mielo, neure or neuro, phobia, psycho or psych, radicule or radiculotropic. Okay. And now let's go to the point. The tendon reflexes, first of all. The tendon reflexes are the examination of the nervous system normally, including the testing the deep tendon reflexes, for example, the knee jerks with a tendon hammer, also known as a tendon hammer. We have three kinds of tendon hammers, more models, of course, and that's the maneuver, the technique we use to check or evaluate this one. We all know about it. Let's not go to the procedure, of course. We know how to do it. But the way we make the report of a tendon reflex is this. The reflexes may be absent. We can mark on 0, diminished with the less, normal 1+, or brisk 3+. Let's go back. The plantar reflexes are also checked. The normal plantar response is downgoing. We have the arrow going down. The downgoing movement, the plantar flexion of the big toe, and upgoing movement, the toe extensor or Babinski response is abnormal. We all know about it in adults. Going ahead. We have this, the deep tendon reflex grading. Please give me a minute, please. Okay, I'm sorry. The deep tendon reflexes, the grading, is a chart when you catch the grade, when we explain how to grade, how to give the result of this evaluation. We have the same way, 0, 1+, 2+, 3+, 4+. And that's the details, the answers we have to show. We have to report in the clinical history. Okay, let's consider this. It's important in my opinion. We all know how to make this. This is an information chart just for taking in account the root supply of each nerve supply and the muscles that are involved into the deep tendon reflex. According to this information, we know which nerves we are evaluating. Just for review, don't worry about it. It's not for memorizing, just for taking in account. Talking about the motor system, we must consider the examination of the motor system should include assessment of the following: muscle bulk, amount of muscle tissue, and look for signs of wasting, muscle atrophy. You can see in the normal muscle and the atrophied muscle, the small right. According to that, we check the muscle tone, the amount of tension in the muscle when it's relaxed, when it's active and it's inactive. Tone can be increased, spasticity, or decreased, flaccidity. That's the way. Spasticity or flaccidity. Same as in Spanish, I think. We have the muscle power, of course, the strength, such this guy, yeah. Then we have the coordination, very important, the ability to use several muscles at the same time to perform complex actions. Gait, the manner of walking, and this kind of reflexes. Here we are showing how it's evaluated, the gait, and how we can prove about it, how we can test in a patient, just. About involuntary movements, well, we have to check this. We have the tremors, we have the myoclonus, the tardive dyskinesia. We also have the tics, we all know about it, and the atetosis. Just as an information. The video I'm going to send to the group, because with the slides and of course in the PDF is not able. But in the WhatsApp group, you can check it continuously. We have this firm difference, the spasm versus the twitch. About the definition, the spasm is the muscle spasm is a long contraction resulting in chronic pain. You know it, pain that it's not comfortable, very, very painful. It's long and persistent and greater pain in comparison of the twitch. It's such a great pain that you cannot move. You sometimes need medication to relax the muscle again. In a twitch, the muscle twitch is a short contraction resulting in mild pain and can be seen below the skin. It's short and mild and relatively less. It's easy to correct with massages, maybe with some topic medication, but the spasm is different, and of course, just for information. The case report. We have an expression on how we must report the physical exam, right? Just as an example. On examination, her face showed little or no expression. There was a tremor affecting mainly her right hand. She had generally increased muscle tone, power reflexes, coordination, and sensation were within normal limits. Examination of her gait showed that she was slow to start walking and had difficulty stop and turning. So check the expressions we use when we make this report specifically to the nervous system, evaluating the march, the way of walking, right? Talking about the motor loss, we consider the symptoms and signs: the weakness, the loss of power, the paralysis, complete loss of power, the tremor, involuntary rhythmic movement, especially of the hands, we know, and the abnormal gait, the unusual manner of walking. According to the gait, we can catch an idea what is going wrong. In the speech, while talking, of course, it might be also affected. For example, with hoarseness, a rough, deep voice, as in vocal cord paralysis. Slurred speech means poor articulation, as in cerebellar disease. And they are symptoms of aphasia. In aphasia, we check trouble speaking clearly, trouble understanding speech, trouble writing clearly, trouble understanding written words, trouble remembering words, and trouble remembering normal object names. I sent these pictures, these slides, showing the symptoms and the signs for making it easier to catch the symptoms, the signs, and according to that information, we can organize the vocabulary and the ideas we are going to use. When we talk about the nervous disturbances, nervous diseases and illness, we must consider the primary motor and secondary motor and premotor neurons that can be affected, in this case in the Parkinson disease. In this slide, we are checking lots of new symptoms and signs or taking in account according to the vocabulary, okay? For example, the tremor is presented in the first signs of PD, Parkinson disease. Bradykinesia is the slow movement, indicating reduction of spontaneous movement. We have rigidity, inflexibility in the extremities, neck and trunk. And the postural instability, a tendency to be unstable when placed vertically. We all know about it, I think. During our medical experience in the college, maybe medical school, or while working in the place we are doing that, we had a chance to check a patient with Parkinson's disease. And if we think about it, or maybe check some books, even in Spanish, English, I don't know, we catch the same information. It's not going to change because of the language. Please check all of these symptoms and signs, and according to that, we can talk about it tomorrow during the workshop. So catch the vocabulary that is there. About the sensory loss, we consider the function, for example, hearing, sight, the sensation, the feeling, the balance. About hearing, the loss is deafness. That's the expression. And other symptoms that can be associated are buzzing or ringing in the ear, the tinnitus. About sight, we have blindness, the double vision, the blurring, the loss of visual acuity, the clarity of vision, right? The blurry vision, never forget it. The sensation, or well, the feeling, the loss is the numbness, the anesthesia. We have the tingling or pins and needles, the paresthesia. So let's consider these expressions. About balance, we have the unsteadiness, the ataxia, and we have the dizziness, the vertigo. Okay, so consider this. There are no common words for loss of conditions relating to taste and smell. That's why that's not another way to talk about it. We as doctors use these expressions: deafness, blindness, numbness, and steadiness. Patients can come to us and give us these expressions: business, ringing, double vision, blurry vision, tingling, pins and needles, dizziness. Maybe another ways to express, to make them understandable their symptoms. But we have to consider that, as I was telling you from the beginning, we have to translate the expression from the patient to the medical terminology. Just as an information slide again, the syndromes of sensory loss. Consider this vocabulary explaining each slide, each picture, and take it in account because patients come and shows you the part of the body that is affected, and they explain the exactly symptom, exactly feeling they have according to the words they know, right? Take it in account just as an information again. And the loss of consciousness, very important topic. When a patient talks to us about this event, they describe it in this kind of ways. They can use these expressions or maybe the other expressions, both in the bubble. For example, I passed out. I had a blackout. I faint. These three expressions are very common and they are for people without medical knowledge. When they know that they have a diagnosis or a tendency to loss of consciousness, they say, I had a fit, I had a seizure, I had a convulsion. So you can see the difference in the way of talking. Both bubbles mean the same. The patient lost consciousness. But the way of expression is very important in order to catch the idea. Fit, seizure, and convulsion are all used to refer to violent involuntary movements, as in epilepsy. We all know about it. And we as doctors may say, when did you lose consciousness? According to this, patients can describe the moment, maybe the area, maybe they can give us some details to catch the exact moment we are talking about. But don't forget these expressions. I passed out, I had a blackout, I faint. I had a fit, I had a seizure, I had a convulsion. We have this slide that is showing us a general vocabulary about the differential diagnosis between an epileptic fit and a syncopal attack or fainting. Here in black and words, we have the vocabulary that is new. And according to that, we can practice, we can talk, and we check more expressions. For example, get a warning, lightheadedness, the syncopal attack, urinary incontinence, loss of control. So check of this. So practice on this vocabulary, and tomorrow we can check the expressions, specific words. There is no trouble. Please read this, it's very important, okay? New vocabulary is coming from here. We also have this slide when I'm showing you the background when the sudden loss of consciousness caused by certain triggers. We have to consider the triggers because there's always an answer about a loss of consciousness. It's not because of yes. We have a reason, we have to find that reason, and we must complete. We have to check this. We have the prodromes, the most common symptoms and signs of prodromes that patients are informed, they know about it, and the pathophysiology in order to check the process of this and understand how we are going to interpret and evaluate this situation. Okay, let's go ahead. Check this vocabulary, please. We also have these acronyms, the CONSNOC, the causes of syncope, the most common ones. The cardiac, orthostatic, neurocardiogenic, seizure, neuropathic, other causes, and cerebrovascular. Practice on this, check this, just an information slide. Of course, I'm not going to evaluate from acronyms. And now let's talk about coma. Well, coma, we all know that it's an unconsciousness with a reduced response to external stimuli. Doctor says the patient is in a coma or the patient is comatose. We have two ways to express about this kind of patients, okay? So let's check on this. Let's practice this and don't forget the way to express about a coma situation. We have the Glasgow Coma Scale. Very important in my opinion. It's a fact to be informed about it, to know about it, not to forget this information and vocabulary because it's one of the bases of our medical career, I think. Check this. And well, we have this, the trauma coma, the criteria, just as an information slide for catching more vocabulary. No other objective of this, okay? Now we have this situation when we are talking about the normal consciousness, the relationship with the brainstem, the vegetative state, when the lesion and the destruction is located, the Lockerin syndrome, again, the damage to the ventral pons in the brainstem, and the brainstem death, of course. Irremediable damage of the brainstem, no way to correct it. Just as an information, catch the vocabulary again. And now we have our used chart of pathologies. Just for showing you the most general, I think, none the most important, but take it in account. The head and meninges, about disorders of the brain, neurodegenerative diseases, brain injuries, level of consciousness. Consider this, okay? We have brain tumors, strokes, cerebrovascular accident, sleep disorders, spinal cord, nerves, pinched nerves, cerebral palsy, epilepsy and seizures, abnormal sensations, and that's all. Just information, the general way to write it down and practice to pronounce it, okay? The abbreviations, the most common that are related to the nervous system, you have the list here. Please practice on them. Of course, I'm going to ask about it. And let's go to the mental illness. Mental illness, psychiatric sphere, not very comfortable to check in my opinion. The common types of mental disorders, of course, are depression, panic disorder, schizophrenia, post-traumatic stress disorder, bipolar disorder, dementia, and phobias. It's a general view of phobias. We have some signs of mental illness. When we take them in account, the appetite or sleep changes, extreme mood swings, chronic low-grade depression, hallucinations and or delusions, unhealthy coping mechanisms, unusual emotional outbursts. So take this in account. General signs or symptoms to evaluate through the time. We all know that it's a process to get this diagnosis. About the psychiatric disorders as a general idea, we have to consider that they can be divided into organic and functional. For example, dementia is a mental disorder due to an organic brain disease. The commonest form of dementia is that associated with the old age, the senile dementia. Disorders in which there is no obvious pathology, anatomical change, or an organ are termed functional. According to this, we have this picture, the senile dementia with all of these signs that are going to be checked through the time. It's an umbrella term used to describe the sets of symptoms, and they include these changes. Of course, there are not all the changes, all of the symptoms and the signs we are looking for, but the most common are here, okay? Then we have this slide when we are checking the psychiatric disorders and the neurological disorders. About the psychiatric disorders, we have all of these. These disorders are related to the organic dysfunction, as we were checking in the previous slide. As I said, they can be organic or functional. Psychiatrics usually are organic. The brain is different. The brain has a detail that cannot work in the same way that the rest of the people. They are neurodivergent and they need a treatment according to how deep they are. And neurological disorders usually are functional. Something in the way of working, not in the structure, is giving us the situation. Please check this information, the vocabulary, and tomorrow we can talk about these abbreviations. Very important, I think. Well, we have the difference between Alzheimer's and Lewy body dementia, just as an information, but take it in account for the vocabulary. the Alzheimer's and the Lewy-body dementia, both of them are in diagnosis after the patient is dead because we need a biopsy. And according to that, we can define correctly. Please check all of this. Okay, evaluate it and practice on. About the substance abuse, we have to take it in account. When a patient is in abuse of a substance, it means that it's using it in a way that it's harmful. The commonest ways of abuse are alcoholism and drug abuse. We consider them as the most common, maybe the most important, in order the activities the patient develop. When we consider that this abuse is becoming a real trouble, an addiction, when we have behavioral changes, for example, secretive behavior, inflexibility with plans, lying about plans, financial troubles, stealing money or substances, isolating, disregard of others. Other signs: poor on academic performance, drastic changes in weight, again, money problems, withdrawal from friends and activities, trouble with law, violent outbursts, excessive sleepiness. Taking into account these situations, we can infer that our patient or our relative or someone we know is taken into a substance abuse. And with these ideas, maybe we can start looking for a solution, but of course it's not easy because if the patient doesn't want to look for a solution, it's not possible to help. About the affective disorders, we consider this. Affect and mood are similar in meaning and refer to the emotions, for example, happiness or sadness. Affect tends to be used for temporary emotions and is expressed through manner of speaking, facial expression, or behavior. Right, the way the person is developing in through the rest of the body, the affect. The mood is used to refer to a more permanent emotional state. Mood is through the time, not just for a few moments, for a few minutes. The mood is common form of affective disorder, is depression. Depression, of course, it's not easy to diagnose, it's not easy to treat, it's not easy to accept that you are living in that syndrome, but well, it's a real situation. The most common symptoms are poor appetite or significant weight loss, sleep disturbance, insomnia could be, the fatigue, psychomotor agitation or psychomotor retardation, loss of interest, decreased ability to think and concentrate, feeling that one is no value to others or that one has done something wrong, recurring thoughts of death or suicide, in the worst cases, of course. 5 or possibly 4 of this list of symptoms occur nearly every day for at least 2 weeks, constitutes a major depression. It's not an easy fact to live in that. But major depression and depression, of course, are not just the only mood disorders. We have the bipolar disorder, seasonal affective disorder, real, and not all of the people consider it like a trouble, chronic depressive disorder, anxiety disorder, psychotic depression, postpartum depression. Not considered important, the postpartum depression, but it's going up, and these times it's a sad situation to take in account, but it's important to take in account to be clear what we have to look for in these cases. Now we have the neurotic and stress-related disorders. Just for checking, for practicing, we have in black and words the exactly terms we have to memorize and practice. And we have this. An example of neurotic disorder is the obsessive compulsive disorder. An obsession is an idea that is so persistent that it interferes with the patient's life. A compulsion is an obsessive idea that forces the patient to act even though they recognize that it's unnecessary. A common form of this is compulsive washing of the hands, for example. Stress is a feeling of being unable to cope. It can lead to anxiety or fear of problems. A sudden attack of anxiety is called a panic attack. So checking these ideas, we have a range of expressions to take into account while talking. Now we have the symptoms of neurosis and the signs, the common signs of neurosis again. And the symptoms, well, we have to take into account because they can make us get into confusion. And well, that's the way we have to express about these situations. Doubt and confusion, emotional instability, fatigue and depression, feeling of guilt and hostility, egoistic disturbance, self-consciousness, anger, anxiety, and irritation. If we have a patient with all of these situations, we have to consider neurosis. About the signs, we have the conflict caused by lack of emotional resilience. This conflict is not easy to solve while therapy. The codependent patient, making them know they are stressed to others, always talking about it. Constant need for validation and reassurance or any matter or issue. Being a perfectionist, losing control of emotions in a serious conversation. So you can see both of them are related to mood and feelings that, like we were talking at the previous slides. Now we have the acute stress disorder symptom and the post-traumatic stress disorder diagnostic criteria. So take it in account. About the acute stress disorders, again, we have more symptoms: intrusive, dissociative, avoidance, negative mood, arousal. The post-traumatic disorder post-traumatic stress disorder, the criteria is talking about negative alterations in mood, alterations, arousal, or reactivity. Duration, we lose the control of time, the intrusion, the avoidance, functional significance, the exclusion, the stressor. When we said exclusion, is that the patient avoids taking medication because consider that everything is going to be okay and it's possible to handle without help. And it's not possible to do it. So take it into account just for practicing more vocabulary. Other types of functional disorders, this include behavioral syndromes associated with physiological disturbance, for example, eating disorders. When we have these potential signs to consider in teenagers and ladies, of course, they are the most common. In guys, when it happens, it's usually in teenagers. We have excessive exercise, preoccupation with feeling fat, abnormal electrolyte levels, intense fear of gaining weight, unusually large intake of food, and anxiety around or avoidance of eating. When we see this, we think that we have the chance to manage this, but it's not possible. Another ways of disorders, we have the disorders of adult personality and behavior. Of course, the personality disorders. I like this slide because here we can check the Disney princesses. All of them have personal situation. They are teenagers and adults, and they have a personality disorder because they want to be accepted without following the rules, maybe, or being accepted with the one that is considered the love of her life, when she certainly has no idea who's him. Or maybe Jasmine, she's falling in love with a liar. No matter what's going on, the liar is the love and nothing is going to change. She has she was unable to go outdoors, and when she got the chance to go away with a guy or with someone else, she did it, of course, with some problems in her response, but there was a thief. She didn't consider this or even the risk. Here we have the Stockholm syndrome, the obsessive compulsive disorder, and it is like that. Just as an example, if we think about it deeply, we get this answer, and it's not my conclusion. It's supported by lots of investigation and some articles in psychiatrics that show us that they are not the best example for kids, for young kids, in order to check to understand the behavior they got. Maybe for a moment to take it and to take the history, but not as a real example, right? Well, now we have the mental retardation, delayed mental development. Of course, brain structure is in trouble, we can say, is not the common one. And we have the faces of our kids, of patients with that syndromes. And this chart that is just for information, showing you how it's possible to catch the mental retardation according to the situation, but just for information, okay? About the schizophrenia and other disorders, which there are delusions, the false beliefs. It's very important. It's useful to catch these symptoms, because maybe we can find a patient that is without a diagnosis. Symptoms of schizophrenia: the positive, the delusions, hallucinations, disorganized speech; negative, flattered affect, reduced speech, and lack of initiative. When we say positive or negative, it's according the moment the schizophrenia is being shown. The positive when the patient is in crisis, and the negative when the patient is under control, we can say. And of course, in children, we have to consider this same situation. Again, we have delusions, flat affect, bizarre behavior, disorganized thinking, positive speech and thought, hallucinations. If we think about a child, that's not the common way of acting, of moving and playing or having fun, right? Just as an information, but take the vocabulary. It's important. Now let's talk about blood, general view of this. We have, well, in model 2, the complement of this part of the class. And now we have to check some abbreviations and vocabulary. So when we talk about the FBC, the full blood count, we consider this the simplest test in the investigation of blood diseases. FBC measures the following in a sample of blood: amount of hemoglobin, number of the different cells, RBC, red blood cells, YBC or WYBC, white blood cells, and platelets, the volume of cells, and the erythrocyte sedimentation rate, measurement of how quickly red blood cells fall to the bottom of the sample of blood. Just take these definitions, take these abbreviations, of course, very common while talking, and we have this anatomical review, of course. For homework, for practicing and taking into account the vocabulary and the way that each structure is described and written down. Then we have this difference, the anemia and the anemia. Anemia in USA, anemia or anemia, the same pronunciation, please, just the differences while writing down a grammar detail, this A. For the UK, both of them have the same pronunciation, have the same objective, of course, just a detail because of their cultures. And both of them can be used in every part. There's no trouble until the information I was looking for about it. There's no difference while using these terms. The most common diseases of blood may be due to bleeding, the loss of blood, excessive destruction of red cells, the low production, for example, diet lacking, deficient in iron, and things like that. You know about it. Well, we have this vocabulary. There is possible to check some blackened words. Please read this dialogue, catch the vocabulary, and according to this, we are going to talk and work tomorrow, okay? So read this, it's important. Check the vocabulary, how it's being described, the situation from a patient, between a professor and a student, a medical professor, of course. And with this information, all the vocabulary is done, so take it your time. We have this, the pernicious anemia, just as an information. This is an extract from a book. And well, we have again in black and words, the vocabulary. We have the meanings of the black and words. Check all of this. And it says pernicious anemia, you can say it's from England, there's no trouble. It's a condition in which there is atrophy of the gastric mucosa with consequent failure of intrinsic factor production of vitamin B12 malabsorption. The onset is insidious with progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and mild jaundice caused by excessive breakdown of hemoglobin because of ineffective red cell production in the bone marrow. A red sore tongue, glossitis, is sometimes present. Patients present with symmetrical paresthesia in the fingers and toes, early loss of vibration sense, and progressive weakness and ataxia. The spleen may be palpable. So you can see. Check the meanings of this, and according to this, we can talk tomorrow. A grammar tip, very important. The verb reduce has several meanings in medicine. For example, reduce can be take smaller. We'd better reduce the dose of your tablets. In surgery, reduce is to return on anatomical position. A hernia can normally be reduced by manipulation, or in chemistry, to remove oxygen from an hydrogen. Nitric acid is a reducing agent. So you can see 3 ways of talking about it into this context, medical context, or the health context. Oncology, let's talk about it, a general, very general view, because it's a huge branch. It's a lot of information. Well, we have the abnormal new growth of tissue. That's the idea we must practice and check. We have the malignant neoplasm, for example, cancer, are likely to spread and cause serious illness or death. We all know about the malignant neoplasm. Benign neoplasm do not spread and are less harmful. Of course, we know about it. When we talk to the patient, when we speak to the patient, we can use the expression growth or tumor. That's why we say, you have a small growth in the bowel. You have a small tumor in the bowel, right? Both of them are considered synonyms into this context. Both of them are in the same response, so don't worry about it. You can use anyone. Now let's see this, more vocabulary. A lump or swelling is a collection of tissue or fluid which is visible or palpable. Can be palpated or felt with the fingers. A lump may be due to neoplasm, but there are other causes such as inflammation or fluid accumulation. The patient says, I have a lump in my breast. Doctor says, there was a firm, palpable mass in the liver. You can see there is a lump, and there are the cancerous breast lump. Feel like how we can feel this mass, okay? So consider this information, take it in count, and practice. Please memorize the vocabulary. Talking about malignant tumors, they are characterized by rapid growth and invasiveness. The tumor may invade local tissues or may spread to distant parts of the body, the metastases. Neoplasms, which are the result of metastasis, are called secondaries, as opposed to the original tumor, which is the primary. Okay, here in the bubble, we have some expressions to remind, to check. We have the results of the scan back, and I'm afraid they show that you have a small growth in the prostate. Fortunately, it appears to be at an early stage. And there are no sign of spread, no sign of metastasis. So if we remove it, there is every chance of a complete cure. When we talk about invade, we consider as a verb, and it's to enter and spread throughout a part of the body. And this process is invasion. If a tumor is described as invasive, it has the ability to spread. Okay, take this in count. Okay. Now we have the benign tumor and the malignant tumor. Just as an information slide, check the vocabulary in the pictures. And we have the symptoms and signs of malignancy. For example, the space-occupying lesion in brain causes raised intracranial pressure and symptoms such as headache, vomiting, or visual disturbance. Tumors of colon may obstruct or block the lumen and cause a change in the bowel habit. Other possible symptoms of malignancy include bleeding, pain, and weight loss. In this chart, we have some sites and some symptoms of cancer metastasis. Take them in count for practicing, for catching the vocabulary and the ways we have to express. Talking about brain cancer, here you have the 10 signs, the most common signs. About colon cancer, signs and symptoms. Again, please read all of this in order to practice the vocabulary, to start memorizing, and the way of expression. We also have the same signs and symptoms of lung cancer, very common in our time, and breast cancer, the same situation. Check all of this information, and according to that, we can be able to complete homework, to be ready for talking. We are acquiring new vocabulary, right? And we have this case. A 33-year-old man presented to his GP complaining of painless lump on the right side of his neck, which has been present for about 2 months and was enlarging. He had been feeling generally well and had lost about 5 kilos in weight. He was also complaining of night sweats. He had no significant past medical history. So you can see, we were talking about the case report in the last workshop. And we have the same way of expression in this. We are describing the situation, we are reporting the trouble of the patient, And well, it's a way of practicing this. About the treatment of tumors, very general view, of course. A tumor can sometimes be completely removed or excised by surgery. If it's not possible, for example, if it has already metastasized to other parts of the body, it may be possible to destroy it by radiotherapy or by chemotherapy. When a cure is not possible, we use palliative treatment, which is only intended to relieve symptoms. We have all of these alternatives, all of these possibilities that not always are effective. So let's consider them and practice the vocabulary. That's the objective of this slide. And don't forget to slow down, keep calm, and go ahead. Be positive, take it easy, unplug, relax, take your time for doing this workable, okay? In order we are answering the poll, I'm gonna give you some information about the classes, about the workshops. Please pay attention. If there is a doubt about the information I'm going to give you now, please send me a message tonight, or maybe make me remind this tomorrow during the workshop. But it's important. Please listen all of this. I'm sending the diary pool to take attendance. Please fill it. At this point, we're in the half part of the course. I mean, we had now the 5th theoretical class, and we have just 8 theoretical classes in the module 1. Now we have the chance to start preparing to the final test. Okay. All the information is coming from the slides. Nothing is new. Nothing is from another book. Start reading, memorizing, practicing, and any question you have about it, please let me know on time, not the day of the test, because it's without objective to ask something the day of the test. You have this week and the next week in order to solve doubts from any class. In that way, don't miss the opportunity of asking questions, of catching the whole vocabulary you can. And well, practice on this. There is a question. Is the test going to be taken as the workshops? As the workshops? No, well, the test is gonna be the next Thursday, not this, the next week, at 8 o'clock for around 2 hours. It's written. It means all of you come to the workshop at 8. Then we start the test with the camera turned on. Please, we have this week and the next one to be sure that the camera is working on. And according to that, as soon as you finish to write down and send me your answers, you leave. I read all of your answers the same way as homework, and I send you the scores that night or maybe the next day. That day is such a long day because, for example, if there is a connection, an internet disturbance problem or something like that, well, we have to understand and then continue. Yes, April 6th. There's another question. Thursday, April 6th. That's the schedule we have. There is not too much time to do as much as we can, as we want. But let's practice on this, okay? Yes, is there a minimum percentage to reach in the test? Okay, for approving the module 1, you need 51%. It comes from, as I was telling you in the first class, it comes from assignments, quizzes, attendance, workshops, everything. It goes to a promedium, and then we have the score. And for the final test, of course, you need at least 51. In my opinion, all of you are prepared for reaching a higher score. But that's the rule from the academic supervisor and superiors, 51 just. So prepare on that way, keep on reading, keep on memorizing, and any question we can do it. Moreover, we were talking, as I was telling you last workshop, about the case report, and we were supposed to have a homework writing down a case report this weekend. I didn't send it because I couldn't finish with all of the students talking about it for solving doubts. That's why tomorrow we have the chance to work on this together. And tomorrow I'm going to make you write down at the moment the case report. And then it's easier to solve doubts about it. So don't worry, it's not a point that we are losing. We are going to have all of this information. So, you know, is there any question, something you would like to know about it? Don't forget April 6th, final test of Module 1. If, for example, unfortunately, someone cannot attend that day because of job or something like that, well, there's no other day to take the test. It's not possible to do it. I was asking for that, and it's out of my hands to give you an extra day to solve the test. It's not possible. So try to be there. I'm going to remind you the same information. And very important fact that I almost forget, if you send homework, if you make homework, you're going to be ready. It's going to be a piece of cake test if you make homework. The test is similar to the homework. We label diagrams. We have 1 or 2 crosswords. I don't remember at this point. We match columns. It's easy to make, easy to answer about it. So keep on preparing, okay? Is there any question, something you would like to know about it? We have this week and the next one. There's not too much time. That's why I like to give this information now. Everything said, I think, right? Hello? What?
Yeah, I think everything is clear, teacher.
Yes, teacher.
Okay, in that order, the ones who fill the pool can leave. I have 15 from 16. There's one who didn't fill it. Don't worry about it. You can leave the Zoom call, the Zoom session. That's okay for me. And see you tomorrow during the workshop, okay?
Bye, teacher.
Okay, teacher, good night.
Good night. Bye-bye.
Good night, teacher.
Goodbye. Tonight I'm going to send the answer key of the homework of the second week. It's enough time. You had a chance to fill it, so don't worry, you're going to receive it in a few minutes, okay? Or maybe until midnight, because I have to run to my babies. I have to rush there. So,
Okay, teacher. Bye, teacher. Good night.
bye-bye. Have a great night. See you tomorrow during the workshop.
Bye, teacher.
Bye, bye, teacher.
Bye-bye. Okay, the pool is done. Okay, everything is done. Dr. Carlos Daniel, can you listen to me?
Yes, teacher, no encuentro el cuestionario.
El pool. Okay, I'm gonna send you the pool again. Don't worry about it.
Please, teacher, thank you.
Okay, don't worry. Okay, can you watch the pool now?
Yes, teacher.
Perfect. Let's do it. Okay,
teacher.
perfect.
Sí.
So, see you tomorrow, doctor. Bye-bye.
Bye, teacher. See you tomorrow.
Bye-bye.